Dr. Kapil Bhargava, consultant cardiologist at American Hospital, Udaipur. I am an interventional cardiologist, and I would like the public to know that atherosclerotic heart disease is the most common disease in the world, and it is the largest killer of all diseases. So basically, what happens is that either the arteries of the brain or the arteries of the legs or arteries of the heart are blocked because of several factors. So there are many risk factors which can cause this disease, like hypertension, high blood sugar, that is diabetes, obesity means overweight, and lack of exercise, high lipids, and smoking. These are the main risk factors. But the good thing about medicines nowadays is that most of these conditions can be treated with drugs. Especially, I would like to tell you today about lipids. So, high cholesterol is definitely a culprit for causing heart attacks and heart disease. So, out of all these lipids, what we are concerned is mainly LDL. LDL means low density lipoprotein. Apart from LDL, you also should be aware of lipoprotein small a, which is a very potent uh, culprit causing very extensive atherosclerosis disease. So first of all, the question is, what is abnormal and how do we treat it? So first of all, for estimation of lipids, the person should be in fasting state. That will give you the correct LDL value. However, for estimating triglycerides, it should be postprandial also. So that gives the value when you have eaten a meal, and 2 hours after that you should give a blood sample. For lipoprotein small a, there is no need to do fasting because it is not affected by food. So first of all, you should know that LDL and lipoprotein A, they are the culprit for causing atherosclerotic diseases. Now the question is that lipids reduction has shown that the mortality and the risk of coronary artery disease will definitely decrease. This is not only by experiments in animals, but also in real life situations where patients, even normal patients, that is what we call as primary prevention, when their LDL was lowered, attack rate was decreased. Similarly, a patient who has already got heart disease like angina or MI, when their LDL was also reduced, then also their further events were reduced. So today, why we want to talk is now because the treatment of LDL is now, you have so many molecules, both oral as well as injectables, which will help us to control LDL and therefore reduce the rate of heart events. Not only that, even stroke rates would be decreasing. So you should be very emphatic in treating high cholesterol, especially the LDL, as well as the lipoprotein A levels. Yes, so first of all, the question in the lay person mind is, what are the targets? What we have to achieve? So remember that for a normal healthy person, LDL should be below 100 to prevent heart attacks. Similarly, if a patient is diabetic but does not have heart disease, his LDL goal will be 70 or less. A person who has already got heart disease or he has undergone bypass or angioplasty should aim for an LDL less than 55. But the Indian Association for Lipids, they are very particular. They say that the Indians have very high risk of getting atherosclerotic disease at a very early age. So, in fact, they are aiming for what we call as extreme high risk patients, LDL even less than 30. So, it has been proven that there is no side effect of very low LDL cholesterol. People initially said that if you decrease the cholesterol, your hormone will be disturbed. You may get a cognitive dysfunction, that is, behavioral changes, and it has now been proven that even LDL as low as 12 will not cause any harm. There will be no dementia. So first of all, you can go very low, number one, and you can maintain this cholesterol level for long. Now, fortunately, we have got a very good molecule called inclisiran, which is now making waves in the treatment of LDL because it can reduce LDL by nearly 70 to 80%. So now what we are trying to do is place it in patients who cannot take statins at all but want to lower the LDL, or patients who are already on statins and are having, they are not able to reach the target. So we are adding inclisiran to statins. So either in lieu of statin or in addition to statin to achieve the LDL target, I mean at least below 50. That is indication of inclisiran. Since it is a very, very potent drug, so even patients who have got heterozygous familial hypercholesteremia, till now even statins were not working in this group. So number one, this is a subset where inclisiran will act best. Secondly, inclisiran will act best when statins are not able to achieve the target, or patient cannot take statin, or even statins plus bempedoic acid fail to achieve target. Then inclisiran is the right therapy, and since it lowers LDL levels like anything, we would now even use it soon after acute coronary syndrome like heart attack, what we call as MI. Well, till now, primary prevention has not been proven, but yes, all patients who have already established coronary artery disease will benefit definitely from this. Patients who have not got coronary artery disease but belong to a family who has got hypercholesteremia will also benefit from inclisiran. So as you should be aware that inclisiran is a very long-acting drug, so it has got a very convenient doses. So on day 0, you have to give the first injection, which is of 284 milligram. It is to be given subcutaneously, just like insulin. So it is so easy to give that any patient can give himself. After 90 days, you repeat the injection, and thereafter every 6 months. So in fact, basically every year you get just 2 injections subcutaneously. So as I said, the LDL targets are now decreasing, and what we are seeing is that despite high dose of statins, people are not able to achieve the targets. So in fact, if you have a rough estimate, around 70 to 80% patients of heart disease will be requiring inclisiran, because inclisiran is such a potent agent that it can reduce LDL by 70 to 80%. Well, in fact, personally also we are using glycerin for last around 1.5 years, and till now, we have not seen any side effect. Only thing is, yes, the cognitive function dementia will be proven later on, because every time we lower LDL, main question is by the people or the doctors that does it have effect on the central nervous system. And as far as the liver and they are concerned, unlike statins, inclisiran is safe. So till now, except for the site where you're giving injection and you can have some induration or edema, we have not seen any long-term safety issues with inclisiran. We have ongoing trials of Orion series, and the meta-analysis is showing, yes, not only it reduces LDL, but it is reducing the number of heart attacks also. And being a very safe molecule, except for local site injection site, there are no side effects of this inclisiran. So it is a very, very safe drug, and I would say all trials are still ongoing, and probably it will show much decrease in mortality, because it is reducing LDL by nearly 70 to 80%.